Let's talk now about that health care plan. President Obama wants a health care bill on his desk by October, but right now, progress on the Senate's version is stalled because of cost concerns. Health care reform is the president's top domestic priority. Will he have a bill ready to sign, though, by fall? Let's turn to someone who has helped develop and implement major health policy reforms in the past. Former Medicare and Medicaid Services Administrator Mark McClellan. Mark is now director of the Engelberg Center for Health Care Reform at the Brookings Institution. He is also a physician and economist. Sounds like a lot of schooling there, Mr. McClellan. Thanks for joining us. Let me ask you. Let me ask you first of all about the odds of this happening. I mean, obviously, President Clinton and his wife had a lot of trouble. Well, legendary trouble now with their push. Is President Obama's push extremely different?
I think the odds are still good. It's a very challenging issue, but I would take the setbacks that you were describing today as really being a sign of progress in a way. The discussion is now moving from general principles about health care reform to how exactly can this be done and how can it be paid for. And so the hardest questions for health care reform are getting confronted right now. It still can be done. It's just some very difficult issues to deal with.
Now, cost obviously is a huge concern, and if you look at healthcare, national healthcare costs overseas, they seem to spiral higher, ever higher and higher. But Barack Obama says this healthcare reform can actually reduce healthcare costs. What's the story?
Well, there are two parts to the story. First of all, if we just expand coverage to more people, that by itself is probably going to increase health care costs. And that's why it's so important to accompany any steps to provide affordable health insurance to all Americans with steps to bring down costs. And there are several good ideas for doing that. President Obama has talked about some steps to promote better prevention, better coordination of care. Right now, most of the payments in our health care system are tied to paying more when you get sick, when you have complications, when your care is not well coordinated, when there are duplicative tests done. There are some good ideas for how that can be changed, but it's going to take some tougher steps than that. The former majority leaders on the Republican and Democratic side, a group that I'm working with, announced a proposal yesterday that had some tough steps, like capping the so-called tax exclusion for employer-provided health insurance so that the expensive plans, the gold-plated plans, don't get subsidized quite so much by the government, and using that money to provide more affordable coverage to Americans who aren't getting any help today.
Hey, you know,
some tough steps ahead.
You're a physician. You must hang out with a lot of other doctors on the golf course and such.
No golfing.
Are they concerned? I'm only kidding. Are they concerned, though, that there will be a cap on how much they get paid? Because it seems to be a general fear that we'll do that and then you'll see a brain drain to other places.
Well, Matt, what's happening right now is that doctors are getting squeezed because when we can't figure out anything else to do about rising costs, including rising costs in the Medicare program, what happens is the payment rates to doctors get reduced across the board. So the doctors get to spend less time with patients. They have to order more tests just to break even. That's the wrong way to pay, and there are a lot of good ideas coming from physician groups today about changing that, paying more for better results for patients, paying more when doctors take steps to get health care costs down. They've got the best ideas. We need to support them better.
Well, Mark, a quick question. One thing that's always puzzled me is why can't any group of people band together and buy health insurance? Is that going to change your proposal so that 20 of us in New York City could be a group and get insured?
Yeah. Well, that absolutely should happen. The ideas that are getting the most support in Congress right now would form bigger health care markets made up of lots of small businesses and individuals, perhaps at the state level, banding together and being able to get lower prices as a result. Also, these reforms would get rid of medical underwriting. That would save a lot of administrative costs right there. The flip side, though, is if everybody's going to be able to buy coverage at a more affordable price, if they're all going to be part of this larger pool getting better discounts, you got to have a mandate or requirement to get coverage.
Mark, quick break here. All right, we are back with former Medicare and Medicaid Services Administrator Mark McClellan, now at the Brookings Institution, and I had to cut you off, unfortunately, Mark, in the middle of Kathleen's questioning, and she's got one more for you.
Well, and Mark, you know, your proposal and the papers you've written up cover so many things, but I've got a very simple question. What about health savings accounts? There are many people say that one of the things we need to do is bring the market back into the healthcare services industry, and a health savings account could do this by giving people an account, a certain amount of money. If they don't spend it, they get to save it, invest it. But it brings choice. I'm going to shop around then and find somebody who can swab my throat for strep cheaply rather than going to the emergency room.
Sure, and health savings accounts have gotten much more popular over the last few years. You know, when those accounts started out, Kathleen, they were viewed as high deductible plans and kind of out of the ordinary. But now if you're a small business or an individual getting health insurance, most of the plans out there have significant deductibles, significant out-of-pocket payments, and you really should look into setting up an HSA at the same time. My hope is that these will be a big part of reform. In the proposal that I mentioned yesterday that the former majority leaders came out in favor of, they encouraged a requirement for getting a very basic level of coverage, the kind of basic plan that would go along with an HSA.
I wonder how you make sure that we have high-quality health care. You know, I've lived in England and Germany. There you see the national health care plans that disappoint a lot of people. A good friend of mine who has been in the same places says, hey, I'm glad I didn't have a heart attack over there because I probably would have died. Isn't it the case that you see lower quality when you go to the national health care programs?
Well, there are some gaps in healthcare quality all around the world, unfortunately. In the United States, we do a very good job of providing access to the latest and greatest technologies.
But we don't have national health care.
Yeah, and we also don't do a great job of... Well, we don't do a good job of putting these technologies together very well. Like I said before, we need to do a better job of paying doctors more when they take steps to deliver better care at a lower cost. And also, going along with the HSA point that Kathleen made, people should have a better chance to save money when they shop around and get the care that they need at a lower cost. That doesn't happen so much in our system today, and healthcare reform needs to empower people by giving them better information on the quality of their care, the cost of their care, things that they can do to save money, and then they should get to keep that money.
You know, one of your proposals has to do with making people responsible for preventive care and wellness. I do weight training. I have certain tenets of eating and exercise that I believe in. You may have some different idea that I think is bogus. How is the government going to enforce or give us incentives when there's no consensus and there's no definitive research on what we should do truly to stay healthy that everyone agrees with?
There's no consensus, but there are a lot of good examples of employers and even schools or communities that have implemented programs to help people stay healthier. And you're right that different things work for different people, but the bottom line is we have got to get our weight down as a nation, got to take steps to exercise more regularly, get better nutrition. And there are programs out there that employers like Safeway and Marriott have tried that seem to work for a broad range of people. That's the kind of thing that we need to encourage. And by giving people an opportunity to save money when they take steps to get healthier, I think that's a good way to do it.
All right. Hey, Mark, thanks so much for joining us. Mark McClellan there, former Medicare administrator, now director of the Engelberg Center for Healthcare Reform at the Brookings Institution, and not a golfer.
Not overweight either.
And no, he's in very good shape, it looks like.